Hi, I'm Taylor Seaman, and this is paid sick leave in the United States. So currently, the United States does not have a national paid sick leave policy. There are some state level policies having to do with paid sick leave, but they vary from state to state and only include residents of those states. This puts the US behind many other developed countries in terms of national workplace policies, including paid sick leave. This presentation will go over why the United States would benefit from a national paid sick leave policy and then suggest a policy for adoption. So starting with some advantages of paid sick leave, research shows that there is a statistically significant correlation between paid sick leave and reduced work-family conflict, on-the-job injuries, spread of disease to colleagues, and improved employee health. The same researchers also found a trend across studies suggesting that those with access to paid sick leave are more likely to receive their flu shots, have annual doctor's appointments, and participate in preventative healthcare services such as Pap screenings and mammograms. The proposed underlying research for all those correlations is that paid sick leaves help individuals attend to their own healthcare needs without the threat of income or job loss. So it is evident that employees with access to paid sick leave take advantage of both preventative and reactive healthcare services more often than those without paid sick leave. This not only ensures better health for said employees, but also increases public health, especially in light of recent events with the COVID-19 pandemic. One would think that the United States government would have public health set as a pretty high priority and therefore take this research deeper into consideration. Looking at paid sick leave in action is another way to see how the benefits actually play out. According to Youngley and Gim in 2021, they conducted a study on the impact of Connecticut's paid sick leave policy on the use of preventative services. There is a significant correlation between paid sick leave and preventative care measures. They found that not only are employees more likely to use preventative service after having access to paid sick leave, but there is a 15.4% increase in routine checkups, 21.4% increase in flu vaccines, 10.9% increase in dental visits, and 11.4% increase in Pap tests among service workers. So although that's on a much smaller scale, only one state and Connecticut of all states, it's predicted that should a policy similar to this one be adopted on a national level, we would see a similar trends in the results. So some disadvantages of not having paid sick leave. One article titled "How Does Paid Sick Leave Relate to Healthcare Affordability and Poverty Among United States Workers?" Investigates the relationship between paid sick leave and reporting the inability to afford needed healthcare services, as well as analyzing the probability of having incomes below poverty, being food insecure, and having elevated family medical care costs. So the four main conclusions of this article are first, that those without paid sick leave are more likely to delay filling prescriptions. Secondly, they are more likely to be unable to afford dental and optometry health care compared to employees with access to paid sick leave. Third, working adults without paid sick leave are 3 times more likely to have family income below the poverty threshold, even after controlling for extraneous variables. Lastly, they are more likely to have elevated family medical care expenses. So all things considered, it's safe to say that the disadvantages associated with not having access to paid sick leave are rather extreme. And another one of those disadvantages mentioned in a different research article found that those without access to paid sick leave also have statistically significantly increased psychological distress compared to those employees with access to paid sick leave. So on the note of absenteeism, one study found that after gaining paid sick leave, there was a large increase in women's absenteeism. And that might seem counterintuitive when you first hear it, but paid sick leave is supposed to give employees the freedom to take off work due to individual or family health issues without the threat of losing income or their jobs. So although paid sick leave might increase the number of sick days taken by employees, female employees in particular, according to this study, it does not necessarily correlate to a loss of productivity. You would be more productive coming to work completely healthy after recovering from an illness than working through the illness, which would slow the recovery process and being less productive on those days you go to work sick. So continuing on that topic, another article titled "Expanding Paid Sick Leave as a Public Health Tool in the COVID-19 Pandemic." The researchers found that providing paid sick leave to workers that previously did not have access to it could positively impact work productivity and decrease workplace costs of absenteeism due to influenza-like illness by billions of dollars. So one of the reasons companies are hesitant to provide paid sick leave is because they claim they're unable to afford it. However, this study shows that providing paid sick leave, especially to those who are currently without it, saves an enormous amount of money. So it's still a financially savvy policy. It might be costly upfront, but it will save money in the long run. So government intervention. Some people don't like the federal government sticking its nose in somewhere where people think it may not belong. So why should the United States have a national level paid sick leave policies? Well, most of the federal policies that relate to the workplace today were established in the 1930s. These policies have to do with social norms and the workplace policies that are extremely outdated and no longer representative of the current workplace system. And excuse me, the government has had no issue intervening with other workplace policies in the past, such as minimum wage and social insurance for workers who cannot work or are unemployed. There's an article titled "The Role of the Government in Work-Family Conflict," and they report that in a nationally representative survey conducted in 2010 by the National Opinion Research Center, 75% of Americans voiced support for a law that would give all workers paid sick days. So that just goes to show that American citizens are supportive of national legislature to address this problem. And lastly, some people might argue that the government has already intervened with the Family and Medical Leave Act, or the FMLA, but the FMLA does not offer any compensation for time taken off, which is the whole point of having paid sick leave in the first place. To move on to a global perspective, one study examined paid sick leave policies around the world in response to the COVID-19 pandemic. So globally, 73% of countries provided paid sick leave from the first day of illness. Nearly all, or a 93% of low-income countries guaranteed paid leave from the first day, compared to 78% of middle-income countries and 55% of high-income countries. However, only about half of countries guaranteed at least 80% wage replacement to employees with 6-month tenure. Many European countries did not exclude self-employed persons or those working for a small business, but many policies did have a length requirement as to how long an employee has been with said company. That being said, the number of countries who received government intervention in relation to paid sick leave is in the majority. Excuse me. So even though there was a length requirement, which did exclude employees who were either new to the workforce or new to their current place of work, a majority of especially developed countries, but also many low-income countries had a government intervention that provided a national paid sick leave policy in response to COVID-19. So my recommendation for the United States is to obviously adopt a national level paid sick leave policy with up to 80% wage replacement starting the first day of illness. That would last up to 12 weeks and have partial wage replacement provisions coming from the government. So the point of paid sick leave is to erase the fear of losing income, being able to take off work without losing money, which is why many people don't take sick days, because they can't afford to not make that money. So 80% wage replacements starting on the first day of illness would erase those fears and bridge that gap very well. 12 weeks, it's a little bit arbitrary, but the FMLA, it lasts up to 12 weeks. And that was approved by Congress. So maybe something that is of the same length and not really stepping on its toes by being any longer would have a better chance of congressional approval. And then wage replacements, if the responsibility of replacing wages falls solely on employers, that would increase the tenure requirement by a lot, which would exclude many employees. So by part of the wage replacements coming from the federal government would reduce the responsibility of those employers and make paid sick leave available to even more employees. Some implications, these fall in line with the advantages and disadvantages that we talked about earlier. There's reduced psychological stress, better access and use of preventative health care services, reducing the risk of being in poverty, and increasing the public health, which makes the spread of diseases less efficient. Some limitations, as I mentioned earlier, congressional approval, tenure requirements, and some people still don't like that government intervention. Other than that, there's not really any limitations. Paid sick leave is very beneficial, and the United States should adopt a national policy. And that's all.